Hello everybody, my name is Cassandra Sandell. I am a special education teacher and I'm so excited to be doing this professional development opportunity for all of you today to provide some insight more on the special education process, what that looks like and how we go through the referrals, and to dive deep into RTI, response to intervention, and how we are implementing that in schools now. We are going to dive right in, starting off with one of my favorite quotes relevant to special education that every student can learn, just not on the same day or in the same way, which is important in all students, especially those with learning disabilities or any disability under the special education umbrella. These students don't learn the typical way, but that doesn't mean that they can't learn at all. So what we'll be going through today in specific will be the special education referral process, what that process formally looked like prior to the creation and implementation of response to intervention. We'll dive into response to intervention, what those tiers look like in the school system, and then lastly we will close out with the benefits and why this is preferred over the old models. So beginning with the special education referral process. So we all should be familiar with what special education is, but how do we get there? How do we qualify students for those services? What does the testing mean? What is the criteria? And traditionally, we were using what's called the discrepancy model in special education referrals. And what this is a method used by staff, special education teachers, support staff, school psychologists to determine if a student has a learning disability. Within this model, staff use data such as intelligence scores, achievement tests, to determine if there is a discrepancy. A discrepancy meaning an inequality or an unexplained answer. For example, if a student's achievement scores are below or inadequate to what they would be based off of their IQ scores, there would be a discrepancy there, an unexplained reason for that imbalance in what they're performing, which would equate to identifying a learning disability. This method has been used widely throughout special education referral processes over the last 30 years in identifying students with learning disabilities. This is more of a wait to fail model. In order for a student to qualify under the discrepancy model, there needs to be a sink or a dip in their achievement and their test scores. They have to be going down and showing little to no progress in order for them to qualify. So this is the less preferred model in a sense that we are waiting for students to fail before intervening, before trying to provide them with any further support. This is what we have used to identify those learning disabilities and has been widely said to show inadequacies in identifying students of color more often than students not of color. So this is a model that we in the special education field are trying to move away from, but it is what we have previously used prior to our next slide, which is response to intervention, or commonly known as RTI. And what RTI is is a system. It is a system of tiered supports to respond to intervention. So when we break it down, there are 3 levels of RTI. Our first level includes universal screening, but would be a base level. All students general education would fit into this first tier within the RTI system. Second level would be regular intervention, students that are identified through the universal screening process that are performing below their peers, performing below grade level standards, just not quite meeting the criteria or exactly where they need to be. And we'll go into that a little more within our next couple of slides. The third level of RTI would be special ed assessment, more intensive, individualized instruction. This would be for the students really not responding to even the level 2 supports that are being implemented within that second tier. So it really is a triangle approach. First level would be all students in the curriculum or in the general education classroom. There would be an assessment, which I'll go into more detail on our next slide, given to all students to identify those not comprehending or meeting criteria. Tier 2, again, would be those identified through that universal screening process where there would be some additional instruction, whether that be a small group, in addition to those Tier 1 supports, depending on the levels of what you're assessing, or a replacement pull-out setting where students are receiving more intervention. Tier 3, again, would be more intense instruction following with a formal special education process. So diving deeper into Tier 1. So universal screening. Universal screening depends on what you're assessing, whether that be math needs or reading needs. The screening tool designated would be something decided upon by a team. A group of individuals looking to implement RTI would identify what fits their class needs the best, whether that be a CBM reading probe, a sight word list, a 1-minute comprehension probe. Depending on the grade level that you're working with would depend on the assessment tool that you would use. That team would also then create a criteria to determine what they would classify struggling learners. This is important for accurately identifying students that would move to the Tier 2 supports, mainly because you want to set an achievable criteria. If you set something that is too high, a standard that's too high or too difficult, you might identify too many students for having too high of a bar. If you are setting a bar too low, you might not be identifying the students that do need the extra support. So creating a criteria in all 3 tiers is really important for accurately using the RTI model. Tier 1 would also include high quality instructional methods across the board. All of these 3 tiers are going to be using evidence-based practices within instruction and progress monitoring. So before moving to Tier 2, you would want to be implementing high quality instructional methods and progress monitoring student data for 6 to 10 weeks before making any adjustments. Tier 2 would be using that criteria to determine which among those students are not showing adequate progress, are not meeting grade level standards, and then those students would then move to a Tier 2 model. So Tier 2 models often are small group, whoever is identified. Again, depending on the learning need that you're working on, it could be in addition to Tier 1, it could be a full in replacement, but oftentimes will be a small group setting being administered by a special education teacher, a trained paraprofessional, somebody who's gone through training and implementation of the specific intervention. More progress monitoring weekly to assess growth. Another important thing, a criteria, what is adequate progress within the intervention and what is not? What does that look like? how long, what is the growth rate that you're looking to see in order to assess what students need to move to more intense support. Typically, you would be staying within Tier 2 for about 10 to 12 weeks before changes are made. It's important to give students time to adjust to the intervention, show what they know. Students go up and down for different reasons, and so giving them adequate time to show their growth is important within Tier 2. Tier 3 instruction or Tier 3 intervention would be students that are not showing adequate progress from Tier 2 supports. Normally that would then trigger a special education referral formally, and then require parent consent before that process really goes forward. This testing is done by special education staff that is trained and school psychologists. Some of these assessments that are administered are intelligence tests, behavior rating scales, teacher-parent interviews, observations done by special education staff. Depending on grade level, it could be student interviews, self-reports, self-assessments. All of these tools and data are then piled together for an evaluation report, and then there is a determination of eligibility based on the data that you have and criteria from the local and state governments. Different states have different criteria that they would qualify students for within different disability categories. Moving on to, there are two approaches. So there is a problem-solving approach within RTI that is based from Heartland Area Education Agency from Johnston, Iowa. Ooh, I am on the wrong side. And this would look like identifying a problem and a cause, developing a plan to address the problem, implementing the plan, and evaluating the effectiveness. This method allows for more team-involved brainstorming and can be better aligned to fit student needs. The second approach for RTI is the standard protocol, where there's one validated intervention selected by the school to support struggling students. This can be easier to implement with fidelity, and is always going to be an evidence-based practice that is recognized and supported with research before implementation. Why does this matter? What's the difference? Well, one of the biggest things that is of importance for why RTI is the preferred method versus the discrepancy model is that it's proactive. It is providing support on multiple levels for a baseline all students in Tier 1. It allows special educators to identify students who are struggling earlier, provide them with supports before their struggles grow and grow and grow. That's something that in special education is unfortunate, but is almost guaranteed. When students don't receive the support they need at an early age, especially when it comes to reading, oftentimes they don't receive that support, and it can be a long time before they do. And as grade levels get more difficult, a lot more independent reading and independent skills are relied on. Another reason why RTI is highly recommended is because it is based on data. Student data throughout all three tiers provide educators with concrete evidence of what's working and what's not working. This supports all students and provides a culturally responsive approach. Like I mentioned earlier, sometimes in the discrepancy model, we're seeing an overpopulation or an over-identification of students of color. It's also more inclusive. It doesn't single everybody out right away. Everybody's doing the same thing. Overall, those are my thoughts on why RTI is preferred, and I hope you learned some great things about special education through this presentation.